long past time for us to cover everybody with quality, affordable health care. And what I have suggested and what I think will work is that we take an already existing plan, because one of the things I learned back in 93 and 94 is that people are in favor of change generally, but specifically people get nervous because even if what they've got is not that good, or they feel like they're losing it but haven't lost it yet, they don't want to have to worry about having something that is less good for their family. So what I've said is that we should open up the congressional health plan. Congress has a plan that covers 7 or 8 million people, and it has about 250 options. And these are mostly good options. They're all private health insurance options, but they can be regulated differently because there's such a big pool of people to cover that you can really get a better result by forcing the insurance companies to do more. And I would require they do even more than that. But it would be open up to anybody who is uninsured or has insurance that doesn't really cover them. But if you have a policy that you're happy with, nothing would change. Because that way, there are millions of people who have a good union policy, have a good policy through their employer. They don't have to do anything. Now, if they lose their job or if their policy is cut back, then they will have this option that will be there for them. And we will make it affordable through a combination of tax cuts that would be health care tax credits. In other words, you would get money to be able to afford to go into this plan. And we would limit the amount that anybody would ever have to pay for their premium to a small percentage of your income. So it wouldn't go up. Now, why could we do this? Because when you have millions and millions of people, you can actually get lower costs. If you have just a small group, you're going to have to pay a lot. And that's why small business is so under the gun. Because insurance companies want to keep the unit small, because then if one person working for you gets sick, everybody's supposed to pay for it. But if you're one of 50 million who gets sick, that's not going to increase the cost as much as you would on your own. And the other reason is because at the same time we'll modernize the system to control costs and improve quality. There's been some great research done at the medical school here and other medical schools about what really works and how we get that information into our healthcare system more quickly. Obviously, prevention pays eventually, but many insurance companies won't pay for a diabetic to go have their feet checked every couple of months, or to go to a nutritional counselor, or their eyes checked, all things that diabetics should have to do. So a lot of poor people who are diabetic, even if they have health insurance, they can't afford the front-end cost of going to get those checkups. But an insurance company will pay if you have to have your foot amputated, because they do the calculation by saying, well, we're not sure we'll insure you by the time you have to have your foot amputated. But if we have to pay to have your foot checked, that's an out-of-pocket cost right now. So we'll just take our chances. But they're not taking their chances, they're taking our chances, right? So I think that universal health care is absolutely essential. And this way, there would be no break in coverage. Everybody would be covered all the time. Insurance companies couldn't deny you coverage based on pre-existing conditions. We wouldn't ask small business to do anything, but if you wanted to go into this large plan, you would get the same benefits of lower costs. So I think we could put together a very attractive package. And the reason why I think it's politically achievable is because I find it hard to imagine that the Democrats won't support it, because we're for universal health care. That's what we stand for. And the Republicans are going to have a hard time arguing against a plan that's based on how members of Congress get their own insurance.